Hey, it's Jessica DaMassa with WTF Health, and joining me right now I have Dr. Jack Resneck. He is the chairman of the board for the AMA, so it's a pleasure to have you here. Thank you so much for joining me.
Thanks for the invite. It's good to be here.
Good. So I really want to jump in and I want to get your perspective on integrating the healthcare establishment into the health innovation movement. We've got a lot of tech companies, we've got a lot of startups, we've got a lot of people who are moving really fast and breaking things. But from your perspective, how do they engage the hospital systems? How do they engage the providers? Are we doing a good job? What do we need to do to improve?
Well, I think, we physicians are incredibly excited about innovation in healthcare. When we see things that actually work and help us take better care of patients and improve patient care, we are early adopters and we actually jump on those things. I would say our experience over the last 10 or 20 years, you look at electronic health records as an example. These were created without many physicians at the table. And now we've got situations where doctors are spending twice as many hours taking care of their electronic health records as they are face-to-face.
And they hate their jobs because
it has created a lot of burnout, right? So, I think most of us love what we do, but there is a lot of burnout as a result of things getting in the way and technology actually being a barrier to patient care instead of improving patient care. So your question's a good one. We really think that having physicians involved in the innovation cycle early will help entrepreneurs to understand what we actually need to help our patients, and what kind of things will work and embed in our workflows in ways that are
weigh in for us. Give us a reality check here.
We're not there yet. We all work with some tools that are very useful and many tools we see that frighten us. And it's not about us being against innovation. We love it. But if you go on the Apple App Store right now and you type in blood pressure and do a search, last I looked, it was the second most common thing downloaded was an app that actually tells you to put your finger over the camera lens and gives you a blood pressure reading. Now, you probably know that doesn't work.
I was going to say, is that accurate?
So if you're looking for a great random number generator, it's fantastic, but that's not what patients are looking for in healthcare, right? And it's certainly not what we as physicians want. But we see other tools out there that are incredibly useful, and we really believe in patients doing home blood pressure monitoring and using that to inform their care. We're going to see more and more patient-provided data that's going to be coming into our electronic health records, but it's got to be accurate data to actually improve healthcare, and it's got to come in a way that's useful. So an Excel spreadsheet of 10,000 blood pressure readings, not useful. So that's why we really have dived into this space in such a major way at the American Medical Association and have created really a whole innovation ecosystem to make sure physicians are involved in early stages.
Weigh in for me. Do you feel like, from the physicians that you've spoken with or that you work with, do you feel like physicians feel like their voice is being heard by the tech community that's trying to solve all these problems in healthcare?
Increasingly, yes, but not always, right? And so when we see tools that are so difficult to work with or that don't do what they say they're going to do or that don't have a payment model to allow them to be covered, we sort of wonder sometimes. But the tech community is really big, right? So there's variation in how much people have looked to physicians and other clinicians to see how things are going to work. But we've decided to take a really aggressive stance on this and to actually step in and do things to make sure that happens in the future. So right here in Silicon Valley, where we are today, we've got Health 2047, which is actually, we were the initial and sole investors in getting this started and are now getting outside investment. And we're looking at what are the biggest problems in healthcare tech that are not solved around chronic disease management, taking better care of patients with diabetes and pre-hypertension. What are the headaches that get in doctors' ways and make the day more difficult instead of more fun and easier and better?
Give me an example of some of those, because I'm curious.
Well, so
Tell us what the physicians find is their priority pain points.
So we just spun off a company called Accuray here in Silicon Valley, and its goal is to solve the problem of interoperability, right? So patients and doctors, their experience thus far has been, we all went on computers. Why can't my doctor down the street see my primary care physician's records? And we've made progress. So in some cases that works, but even still it comes through and just like giant reams of electronic data that are not even organized and useful for physicians to take care of patients. So that's one of the companies.
Yeah.
We've got a lot of other irons in the fire. We've got this thing called IHMI, the Integrated Health Model Initiative, and the goal of it is actually to convene multiple stakeholders. It's not just for us at the AMA to decide, but groups of physicians and payers and employers and patients and others to say, for a given disease, what are the 100, 150 most important things we would want to know to make sure that those data are being stored and organized in a way that's useful?
Okay, weigh in on the old AMA digital health snake oil of the 21st century comment for me. I know we've moved past that, but have we moved past that? I mean, because this is the thing. I mean, I do feel like, still, your doctor doesn't want you to Google your symptoms, right? Because of a lot of misinformation that's out there. And there's a lot of good digital health apps, and there's a lot of not so good digital health, like the one you mentioned about your blood pressure. So I guess talk to me about some of the fears that you guys have and how you want to see the industry work with an organization like the AMA to kind of move past this stuff. So talk first about the issues.
So we are going to speak up both when we see great products that do great things. We're going to adopt them, and we're going to speak up, and we're going to cheerlead for them.
Good.
And when we see things that we think are hurting patients, we're going to call it digital snake oil. Mm-hmm. So, that hasn't changed, and we really think that's our duty and part of our ethical responsibility to our patients. There is still digital snake oil out there, sitting alongside really good things. There was a presentation at this meeting. I stood up and asked a question about a symptom checker. And I think symptom checkers could be really useful someday. I actually like patients who've spent some time online and come to me educated, or who go read about their diseases after their visit. Do they sometimes find things that are inaccurate on the web? Of course,
Sure.
And that's where we get to sit down together with a patient and sort of work through that. This was a product that was released out into the wild and patients were using, and I found that when I just put in some classic symptoms for diseases I take care of in dermatology, it was not coming up with the right answers. So again, I think the AMA was founded in the 1840s, and one of the first things that we did as an organization, obviously before my lifetime, was created a code of medical ethics. So, it is a new AMA. There are a lot of things that have changed since the 1840s, and we are very deeply involved in tech. But I feel it's my ethical responsibility to really say, this is a great tool, this one not so much, and so we'll keep working at that.
Is there any area of the care delivery or medicine in particular that has you personally excited, like the most excited? Like, are you a microbiome guy? Are you a CRISPR guy? Or are you just like, I don't care as long as it fixes interoperability issues? What are you most excited about?
So I'm a dermatologist, so I take care of melanoma patients. There's really cool stuff going on in diagnosis and treatment of pigmented lesions and melanomas. But the thing that gets me most excited is actually the opportunity to remove pain points for physicians that'll allow doctors to spend more time with and take better care of patients. And I think we have the potential to get there, and again, that's why we're investing so heavily in the innovation space. We do, look at physicians and how they're spending their days, and the amount of time they're spending clicking away on their EHRs, wasting time. We think we can help fix it. It's been a lot of years of other people not fixing it, and so we think it's time for physicians to actually be in the rooms helping to make those solutions.
How, less advice from you, how can the tech world work better with physicians? What's your best advice?
So first of all, entrepreneurs have a lot of great ideas, and funders are out there looking for entrepreneurs with great ideas. But whether you use us or somebody else, have practicing physicians engaged early on in your process. Ask, am I solving a problem that physicians and patients actually have, or do I have a solution that actually doesn't fit a problem that's out there? Think about validating. If you have a tool that's measuring something, make sure it's properly validated, and then think about how is what I'm creating going to fit into existing workflows. Because we don't have physicians sitting around the country twiddling their thumbs, reading novels, thinking about, God, I just wish a bunch of disorganized data would come into my portal tomorrow,
If only.
and keep me busy. We have really busy physicians who really are working hard to take good care of patients and who are craving tools to help organize data and help make it work better. So involve physicians early. That's my advice.
Great takeaway. Thank you so much for joining us here.
Absolutely.
It's a pleasure to speak with you. Always so great to hear from the AMA and the physician perspective on anything. So thank you so much.
Thanks for inviting me.
I'm Jessica DaMassa with WTF Health. Thanks so much for joining us here at Health 2.0.